Hello and welcome to the MedCity Pivot Podcast. I'm your host, Katie Adams, an assistant editor at MedCity News, which covers innovation in the healthcare industry. Today, we are kicking off this year's season one for the Pivot Podcast, which is going to focus on healthcare cybersecurity. In just a moment, I will be joined by a healthcare cybersecurity expert, Florence Hudson. She's got a few titles, a few roles, one of them being Executive Director of the Northeast Big Data Innovation Hub at Columbia University, and another one of them being Senior Member of the IEEE, which stands for the Institute of Electrical and Electronics Engineers. Hudson serves as chair of the IEEE's 2933 Standard Working Group, which just established a framework for the better protection of clinical data, improved device validation, and interoperability at scale. So I'm excited to hear what Florence has to say about why her working group felt the need to release a new framework like this. And I'm excited to hear about what exactly this framework entails and why organizations could benefit from adopting it. So let's tune into the conversation now. Florence, thank you so much for joining us on MedCity Pivot Podcast.
It is wonderful to be here. Thank you so much for taking the time and for chatting with me today.
Of course. Well, to begin our conversation, I kind of wanted to level set a bit about healthcare data and talk about why it's so valued by cyber criminals. I often hear that it's much more valuable than financial data, and I see statistics like, these cyber gangs value healthcare data 40 to 50 times more than financial data. So I wanted to know why that is.
Well, that's a good question. Usually we worry about our financial data, like, oh my gosh, multi factor authentication on our phone and they have my credit card number. But you can change your password and you can change your credit card number. Healthcare data doesn't change. And there's so much information. You have the patient's name, their date of birth, their medical history, their physical and mental health information, which is really very private. You don't want someone knowing that and using it against you. The medications you take, someone could look at that and say something about you, your healthcare insurance plan and your account number, your social security number. And all of this is forever. Your medical history doesn't change. If something happened to you, it happened to you. And so people have this information and they can use it against you. And it's really very sad. So they can get financial remuneration from you or from another provider. It could be that, a hospital or a healthcare provider is the one that's hacked and then they're liable for that. So there's financial harm, there's reputational harm, there's human harm. And unfortunately, there are people who just want to do harm. Sometimes they do it to make money and sometimes they just do it to cause harm, unfortunately. And that's why we created this standard because we're really trying to protect the humans.
Yeah, it's definitely clear that there's a lot of harm that could be done, which is why I think, an organization that you're involved with, IEEE, does what it does and why it felt the need to issue a new framework last year geared toward these privacy protections and the security that we need in healthcare. So could you describe that organization you're part of, IEEE, and why it's putting forth new frameworks like this?
Yeah, thank you for asking. So IEEE has actually been around since 1963. And believe it or not, we have 460,000 members around the planet. And we're all volunteers. We don't get paid to do any of this. We're all very mission based. We're a bunch of engineers usually, and we're trying to fix things. We're trying to make the world work better. And we're 460,000 members in more than 190 countries. And our goal is to advance technology for humanity. How cool is that, right? How do we help the humans? Wait, like, what would that be like? So if you think of like the Wi-Fi standard you use, like for your phone or your medical device, 802.11, they call that standard, was created by IEEE. So it lets all of these devices connect to each other. So this last year, IEEE was looking at all the trends going on technologically, and they came out with a report on 4 foundational technology trends to watch. And they said that as the world becomes increasingly more digital and by extension more connected, an emphasis will continue to be placed on universal human values, including trust. Do you trust each other? Do you trust the device? Do you trust the software? Do you trust the cloud? Identity. Do we know the identity of that device or that human? Should they really be getting into my data? Privacy. There's regulation, but also you want to make sure your information is private. Protecting the humans, the institutions, reputations, financial protection, ensuring safety and security. And so adhering to these principles of tips isn't just about preventing data breaches, but also building trust and ensuring the ethical use of technology. Technology has been evolving so much in that now it's like inside humans, or humans are inside the technology. You're in a car, or there's an implanted medical device. There's so many more implications now when there's a risk with technology. And so personally, I was on the Internet of Things World Forum Steering Committee a number of years ago, and we were talking about the lack of standards for end-to-end trust and security. You have all this stuff that's connected to each other. You've probably heard of some of the hacks where I think there was like a casino in Vegas, and they got into like the pump in like, a fish tank, and then they got into the casino systems. It's like, how does that happen? All of this stuff is connected. And so we really have to think about this and ensure that we have standards, for healthcare. And then we're looking at taking tips and applying it to the smart grid, autonomous vehicles, and more, because all this stuff really is hackable. So we started this all by doing a workshop in 2016 at George Washington University in DC. And that led to the establishment of these TIPS principles: trust, identity, privacy, protection, safety, and security. And we decided to apply it first to clinical Internet of Things, because if you hack an implanted medical device, you can immediately kill a human. So we're trying to keep the humans alive. We're trying to reduce the risk. And then we're looking to bring it to the smart grid, autonomous vehicles, smart agriculture, water management. You've probably heard there was a water system that was hacked and shut off. All of this can happen. And within healthcare, we made sure that we looked at, implanted medical devices, how it connects to an electronic medical record, how it connects to other technology in a hospital. So really looking at what we call the system of systems, how everything connects to each other, and then trying to protect it.
Yeah, thank you for laying out what the TIPS framework means and why it's needed right now, especially more than ever. But I'm wondering what gaps in healthcare cybersecurity that this framework is addressing. There seems to be many, many ways you mentioned that a healthcare organization could get hacked or could get breached. So, what does something like TIPS do to make sure we can patch up those vulnerabilities and close some of those gaps?
Well, the unique thing about TIPS is that it's the whole picture. So there are security standards or privacy regulations or interoperability frameworks. Nobody's pulled it all together before. And that's one of the reasons that we had over 300 people that were in this standards effort, because we would tell people, okay, we're doing end to end trust and security, trust, identity, privacy, protection, safety, and security. And anybody in healthcare would like look at me in the eye like a laser beam and say, thank God you're doing this. Nobody else is worrying about this altogether. Because if you have a device, you focus on that device. If you have a certain thing going on, you focus on that. But the question is looking up and seeing how all this is connected. So that's what's really different about TIPS, is it brings it all together. We also refer to a number of the other standards in the TIPS standard. One of the funny things we say in standards for geeks like us is the beauty of standards is there are so many of them. you know. So there are other things that people know like fire, HL7, low ink, SNOMED, all these different things, right? 11073, people love throwing these numbers at each other as standards people. But this really brings it all together very comprehensively. And we built it on purpose to be extensible into the future. And you might say, how do you do that? You don't know what's really going to happen. No, but we have an inkling. We know quantum is coming. We know, augmented reality. We know new digital identifiers. So we made sure as we were developing the standard, it's looking at today's technology, but then like with a strategic view of, where might this be going? And then what you can do with standards is then you can do like a new version of it. But we wanted to make sure we had a solid base to start with today's technology, for technology that's already being used, new technology that's being created either by very well established healthcare companies, or it could be a brand new company with a great idea, like, oh, we have this great idea. And maybe they've never had to worry about security and privacy and trust and identity and all this stuff before. So it's really a great resource for really any company in the healthcare space: manufacturers, EHR, EMR vendors, software solution providers, the healthcare providers, the hospitals, the doctors, the patients. Actually, one of our visions is that when I was a little girl, I'm a geek, I used to crawl around looking for the UL tag on things, which means underwriters laboratories, because I knew that meant that the electric boards were safer. And so we actually invited UL to work with us at IEEE, and we created this standard together. So when it was published in September, it was published by Underwriters Laboratories UL and by IEEE. And the little story I tell is, in a few years when this is all deployed and in all these different devices, there'll be a little girl at the doctor with her grandmother, and the doctor will try to give one of them an insulin pump. And the little girl will look up at the doctor and say, "Does it have tin?" So the idea is to teach the humans so that you know to ask for it. Children know to ask for it. Grandma knows to ask for it, or her granddaughter knows to ask for it, so that people know that there's a way that they can be safer because all of this stuff is hackable.
Yeah, that makes sense. And this is no doubt a new responsibility that hospitals have been really having to take seriously in the last 10 years or so. But it's also a new cost, added expense, because there is a cost of compliance to this all. So, could you talk a little bit about what that looks like, how much it costs for healthcare providers and various healthcare organizations to implement a framework like this?
Yeah, so it's kind of like getting an insurance policy. What's the cost of the insurance policy? But then what's the cost if, like, your house burns down or, God forbid, you get in a car accident? So it's the cost of not doing it. So when you have a data breach or, God forbid, there's a human situation that occurs, so it's really protecting against those. So it protects the humans, your financial and reputational risk as a healthcare provider or an institution. And what we're doing is we're building a maturity model for this tip standard. So you can start where you are today and then decide, look at where are the biggest risks. So what I tell people is you should get something, a piece of paper or a board you can you draw on and say, where are all the potential attack vectors we have? Probably a lot. It probably looks like the Milky Way galaxy if you really think about it. And so look at all of those and then decide what are the most important ones? Where is there the most risk? And what do you want to get started on? So for like trust and identity, some people call that identity and access management or IAM. Like, how do you know that you can trust the humans getting into the device? What sort of technology are you using for that or validation? How do the devices know to trust each other? Who's validating the identity of the devices? Is there a device registry? What sort of privacy controls do you have? How many countries are you doing business in, and what are the privacy frameworks in those countries? In the EU, it's the GDPR. In the US, it's HIPAA. There, in California, it's something different. There are all these different things. So the real purpose of this is looking at the whole system and doing a very holistic view of where are the risks and then how do we reduce them. So over time, the idea is that it will cost less, there will be less risk, and it'll be easier to implement a more secure and private environment because you built it right in.
Among these many, many risks you're talking about, I think a lot of those come from third-party tech or, your third-party vendor partners, especially if you're a large health system with thousands and thousands of vendor partners. And it can be really hard to manage, how all of your partners are handling their cybersecurity and if they're all up to speed on these practices. So could you talk a little bit about what it looks like approaching that or managing that?
Absolutely. So we actually talk about the supply chain in the standard. And I was actually presenting this at a HIMSS event a few years ago. Your viewers probably know HIMSS, the Healthcare Information Management System Society. And they had me as the closing keynote of the cybersecurity conference to talk about tips because it's so important. And there was someone from CISA there, the cybersecurity group in the US. And so I grabbed him on the way out the door and said, "So what do you think?" He said, "Just make sure it has the S-bound in it, the software bill of materials, because you really have to track the provenance of all this technology, right?" And so those are some of the elements that we make sure are in it. And that is the software supply chain, right? Then there are all the vendors, as you say. So what's really important, as an example, I'm chair for this working group, that created this clinical IoT with TIPS standard. One of our co-vice chairs is actually the chief information security officer at Indiana University Health. And so he said, what you have to do is work with all your vendors and let them know that you expect them to have this level. And I would say, ask your vendors to get the tip standard, the 2933 standard, and start looking at where are they. And then, the patients should expect it, the providers should expect it, the hospital should expect it from their vendors. And as they create new interoperability solutions, they should be bringing everyone together saying, okay, how are we going to make sure we have security and privacy for data at rest, data in motion. We have sample use cases like hospital at home, which became more prevalent during COVID, where people, tried to stay home where there wasn't room for them in the hospital and they were getting their care at home and then beaming into the hospital, people keeping track of them and then home to hospital. Now, what if you take all that stuff with you and you get into the hospital? How do you keep all that data and make sure that it transfers and interoperates very well? So we look at all these different elements. So you're right, there's your vendors, there's the supply chain of the data as well as the devices, as well as the transport of the patient. There's so many supply chains in the healthcare sector. Very interesting. And so we encourage people to worry about all of them.
Yeah, and another thing that I think is interesting hearing you describe, all these elements that you have to consider and make sure you're staying on top of the cybersecurity posture of, is that all health systems, no matter big, small, rural, urban, all of them have to make sure that they have this at the forefront of their mind. And, I cover hospital finance a lot, and while it does seem to be improving from some COVID levels, it is kind of becoming a story of have and have nots. There's a widening gap between these very well resourced hospitals and these ones that are struggling with really tight margins, oftentimes maybe in rural areas, or maybe they don't have the ideal payer mix. So, they can't skimp out on cybersecurity. So, for healthcare organizations of all different resource levels that may not have a large budget to beef up on cybersecurity, where can they begin to mitigate these data risks? And, it seems like a non negotiable. So, how can we give them a little bit of support when these threats are so dangerous and so severe?
That's a really good question. Well, by working with the manufacturers of the devices and the solutions, those are the things everybody's going to be using. So, whether you're a huge hospital with a lot of funding or if you're a small hospital, sometimes the small rural environments have the most advanced tech. Have you noticed that? Like sometimes you'll go to a small town and, like, oh my gosh, this is all automated. What's wrong with me? Right. So, by working with the device manufacturers, the hardware, software, firmware, and solution providers, that can actually serve all these different environments. Now, if they already have technology in place, I suggest that they get the TIP standard and they start looking at where in those different trust, identity, privacy, protection, safety, and security elements they are. How secure is it? Have they really looked at it? Have they asked their vendor to do that? So I would say they should just jump in and start doing a self assessment on tips. We have the sample use cases in there for people to look at. We even have information on, it's when you get the device, it's when the devices are interoperable, but then when you decommission the device, if a patient gets a new device and then the device is actually going to be sent to an underprivileged area and used for another human, make sure you wipe all the data on that device. So we go through the entire ecosystem for them. And so if they're in an underserved community, it could be that they're getting some of these devices that may have been used before. So they should make sure that they're, getting all the data off of them before they give them to another client or patient. So there are a lot of techniques and process recommendations in the standard that they can do. It's not all at the technology level. There's encryption and, key pairs and all the technical things you need to worry about. But there's also the processes that you do to make sure that you're making it as secure as you can. And that would be very valuable for them to do. And as I said, they should prioritize. Look at what they're working with and say, where do I think the greatest risk is? And if they don't have somebody, we talked about in our working group that, we have 300 people who are part of this, creating this standard. And some of them are very interested in working with people to help them use it. So they could always reach out to IEEE. They could reach out to me on LinkedIn, Florence Hudson. It's kind of easy to find me. And we can probably find people who can help them. But I would tell them to jump in. And we're already, one of the reasons that we invited people who are in the healthcare system to help us develop this standard is because they know it and they can help. So, I was mentioning we have a CISO from Indiana University Health that was a co-vice chair. The other co-vice chair was from Medtronic. So now they know all about this standard. Our secretary of the working group is from Draeger Medical Systems. So we have someone from Cerner. We have people in the zone that are working on it. And so they will be able to help as well. And then, we'll be presenting more and more. And this is a great opportunity for more people to learn about it. And I would say just jump in. I've also done a couple of books on tips as we've been developing the challenge and the opportunities with Springer Nature. They could go to my consulting website, I'm also CEO of FD Hint. It's Florence Hudson International. It's a strategic consulting firm. And you can go to fdhint.com and look at my writing. And we have a couple of Springer books, one on securing the future for IoT and one on securing the future for connected healthcare. And there's a lot of publications that IEEE has done on this, and they would be able to start reading about it and just applying it. But they must have someone who knows something about IT or cybersecurity wherever they are, and they can get started with that and then reach out to others to get help.
Well, it seems like help and assistance is certainly accessible, so that's awesome to hear. And just a big theme of our conversation so far today has been the need to get healthcare organizations kind of on the same standards, working with the same frameworks. I guess earning a little bit of cohesion among the cybersecurity practices amongst various healthcare organizations. And this seems to be something that regulatory bodies are kind of cracking down on too. We're seeing more cybersecurity requirements for providers, and then especially with these recently proposed changes to HIPAA, these aren't finalized yet, but there's certainly something that seeks to make sure that healthcare organizations are kind of on the same framework and operating using the same standards. So, do you think regulations like that will help lower the amount of attacks over time? Do you think this is a step in the right direction?
Yeah, so the reason for the attacks is that it's financially lucrative for the bad actors. It's not because the healthcare providers don't care, it's because people are going to try as hard as they can to do it, unfortunately. And the regulations, they don't care about regulations, I don't think. They just do what they do. The regulations will help the providers and the manufacturers and perhaps the payers also, if they look at what they want their providers to do to focus on these issues. So their standards and regulations will help the device manufacturers focus, the solution providers, and all of the whole responsible ecosystem to improve, the tips elements to reduce these attacks. But as we said, one of the issues is that the bad actors want to do it. And with regulations, organizations don't necessarily have a clear path to implement them or really measure maturity. So that's another challenge is how they can actually look at how the regulation affects them. If there's, like with GDPR, it's like, okay, you mess this up, it's going to cost you this much. You mess this up, it's going to cost you that much. But not all the regulations are exactly like that. So the question is how we can have the regulations have more meaning and more teeth and actually be more communicated, better communicated to the leadership team so they know what the risk would be. But just looking at the potential financial, human, and reputational risk of having these attacks, I think should help them focus. Increased regulation would be something that could probably help as well, but unfortunately, any device or application can really be an entry point for a bad actor. So regulations would need to be rather comprehensive. And also one of the reasons for a large number of successful attacks is that healthcare information security is pretty confusing. And, there are so many devices. I know when we were first looking at this a number of years ago and I was creating the IoT strategy at IBM and I was working with some healthcare companies and I met with a CIO of a large healthcare firm. He said, I probably have, and this was probably 10 years ago, there are probably hundreds of thousands of connected wireless devices or wired devices in my hospitals, and I don't know where they so there's better management now. It's easier to find them. There's a lot of location-based services and stuff like that, but there's still a lot of uncertainty and people walk in with devices. You walk in with your device and then that can connect to something, right? So there's increasing risk. So regulation can help, but I think what we all have to do is really be responsible, be responsible stewards of technology and healthcare and really try to protect the patients, which is what we do in healthcare anyway. There's actually an organization called I Am the Cavalry. I don't know if you've heard of them before, but I've gone to DEF CON or Black Hat or some of those events before where the cybersecurity folks go. And a number of years ago, there was a guy that was there and he looked out at they were talking about medical IoT devices and he said, the cavalry is not coming. We are the cavalry. We have to fix this problem. And so that's what we're trying to do. We, the technical people, let's see what we can do to help. And we all have to take that, responsibility, I would say. And we're excited that now we have the TIP standard so they can dive in. I know there was another large IT firm that recently started working with us and they said, oh, we read the standard and said, oh, but do they have this? Oh, that's in there. Oh, but do they have this? Oh, that's in there. So it's very comprehensive. So that's why it's kind of long. but it's nice and comprehensive so a lot of people can sink their teeth into it. And then we're also looking at creating like an executive level version of explaining it and having them assess their maturity because that's where, the financial and brand reputation, that's what they think about that, the executive leadership. And then there's the technical teams that go dive into what about the encryption and what about, the key pairs we're using and what about this form of interoperability and are we using Fire and HL7 or what's going on over here? So there are actually multiple layers of thinking through this. The leadership team that worries about the humans, the finances, and the regulatory, challenges and the brand reputation, and then the technical people who can actually help make it work. And then the patients and providers that care so much about doing no harm.
We are the cavalry. I like that as a call to action. Thank you for sharing that. And I wish you nothing but luck as we continue to beef up cybersecurity across the sector.
Thank you, and good luck to all of us.